An oligopoly of pharmaceutical giants continue to influence Australian politics, media, and regulatory industries to promote an agenda of consumption over healing, disinformation over informed discussion, and manipulation over security of their products across the world. While Australian media has been focused on the so-called festival pill problem, prescription drug addiction continues to fly under the radar as Australia's leading cause of drug-related deaths across the country. Information suppressed to ensure medical giants continue to profit off pain and addiction. G'day everyone, Ethan Nash from TOTTnews.com here, and today we're going to take a look at the influence of Big Pharma's footprint in Australia, particularly a brief analysis of prescription drugs, including related statistics, national systems being established to control your medical information, and a look at how alternative medicine is being systematically eroded. Over the last 20 years, Australia's drug problem has continued to rise to reach heights not seen since the peak of illegal substance abuse in the 1990s. However, the cause of the spike is much different in modern Australia as opposed to back then, with a new king rising to take the crown: Big Pharma. That's right, pharmaceutical products, particularly prescription medication, is now the primary driving factor behind the re-emergence of Australia's drug problems, with many pointing to a direct correlation between the growth of Big Pharma in Australia and the rise of these statistics. The pharmaceutical industry has transformed significantly since its incarnation in the early 20th century, now centred as one of the largest industries in the world, and as one of the Big Six markets on stock exchanges in various countries across the planet. The worldwide pharmaceutical market revenue in 2013 was $980 billion, almost twice as much as it was only 10 years before, at $498 billion in 2003, according to statistics. In 2014, global pharmaceutical revenues for the first time increased to over $1 trillion, solidifying the industry as a behemoth that is only continuing to grow. The Australian Medical Association has recently declared prescription drug addiction a national emergency, with Australia currently in the same situation as America in regards to unprecedented harms being caused by the abuse of prescription medications. Scriptwise spokesperson and AMA WA Council of General Practice Chair, Dr. Steve Wilson, said in Victoria alone in 2013, intentional or unintentional overdoses from prescription medication exceeded the state road toll. Shortly after this revelation, Australia's rate of prescription drug addiction was reported as second highest in the world in the 2014 United Nations World Drug Report, only after the United States, afflicting 3 to 4% of the population. Prescription drugs caused the highest number of drug-induced deaths in 2016, with a total of 1,808 registered in Australia for the year, according to Australian Bureau of Statistics data. These are similar rates recorded in the 1990s when Australia was in the grip of a heroin crisis. The harm caused to society by the widespread abuse of prescription drugs is second only to the harms of alcohol abuse and is increasing each year. To explain this rapid rise in the rates and effects of prescription drugs on Australia, we need to take a look at recent research that suggests a link between pharmaceutical marketing and the distribution, overdiagnosis, and overtreatment of certain conditions in Australia. Researchers from the University of Sydney have analysed 4 years of Australian pharmaceutical industry-sponsored educational events for health workers dedicated to 3 conditions: depression, overactive bladder, and osteoporosis. Published in BMJ Open today, the research reveals that a handful of companies sponsored the majority of the events, and GPs were often targeted, with most events offered attendees dinners. Dr. Barbara Mintzes, lead author and senior lecturer at the University of Sydney's Charles Perkins Centre and Faculty of Pharmacy, said the findings highlighted the need for professional education to be free from commercial sponsorship. Quote, "We examined over 3,000 events with almost 100,000 attendees by healthcare professionals from October 2011 to September 2015. Just 2 companies sponsored over 70% of the depression events we identified. Another 2 companies sponsored over 80% of the bladder events, and 2 companies sponsored nearly 50% of osteoporosis events." End quote. In fact, nurses, dietitians, pharmacists, and other allied health workers are getting millions of dollars in payments from big pharmaceutical companies for their services. New figures show that pharmaceutical companies spent more than $2 million on consultant fees, educational events, like overseas conferences and guest speaking roles, for allied health professionals between 2016 and 2017. This also includes both sides of Australian politics, who receive millions of dollars each year from pharmaceutical giants, both at home domestically and overseas. Despite clear correlations shown between Big Pharma's relationship with the medical industry, increased rates in prescription profitability, and subsequent rises in drug-related statistics, the mainstream establishment continues to promote the agenda of pharmaceutical giants while offering non-issue solutions to questions that haven't been asked by the public. For example, in response to the growing prescription crisis, health officials have now introduced changes in recent years that attempt to curb the spike in drug-related problems. But have any of these changes actually made an effect? Or are they all just a distraction or part of a different agenda altogether? Early last year, drugs containing codeine will no longer be available from pharmacies without a prescription, a controversial measure that was fiercely opposed by many groups when first proposed and later introduced. The changes to regulations for codeine products by the TGA has been introduced to supposedly address Australia's growing opiate crisis. However, health experts are concerned the move has unintended consequences, such as pushing people towards illicit products. However, instead of directly addressing these concerns, health authorities believe a national real-time monitoring system for patients prescribed codeine and opiate products is needed to mitigate the risk, according to The Guardian. Now, this was in January, just months before the My Health Record system was announced to transform into an opt-out system, with over 17 million digital identities now set to be created for medical access following the end of the opt-out period. A drug problem solved with greater surveillance and punishment all suggested at the same time a national system was about to undertake a massive shake-up. Could we be seeing a classic case of the Hegelian dialectic at work? Problem, reaction, solution. The My Health Record system is an automatic digital health record for Australians where personal health information can be viewed online from anywhere at any time, even if you move or travel interstate. Medical professionals will now be able to access health information from any computer or device that's connected to the internet and can allow others to access the record, such as hospitals. The system is a good concept in theory, given the problems with individual GPs and hospitals storing different information about patients, and even better when it was announced that police, the ATO and Centrelink are refused access to your medical information without a court order. But as they like to say, if it's too good to be true, it normally is. And this is because amidst a string of Senate hearings on the program, despite strict measures in a number of areas, guess who is conveniently allowed to view personal files? That's right, Big Pharma themselves. According to recent reports, Caroline Edwards, the Deputy Secretary of the Department of Health, told a Senate hearing recently that third-party access arrangements would allow medical and public health researchers access to, quote, de-identified data. Quote, if they're researchers for a private company, they would need to put in a submission explaining what the purpose of the research was, and each application would be assessed in its own merits, unquote. So here we have a pharmaceutical hierarchy that not only has increased the manufacturing and distribution of their prescription products, who regularly pay millions to influence profitability through avenues such as doctors, politics, and pharmacies, now is allowed to access what has been rolled out as the solution to the problem they created in the first place. Do you see what I'm trying to say here, people? What do you think will happen if Big Pharma can access your personal medical files? In fact, any company allowed to understand your needs on an individual and digital level can take many avenues with your data, whether it be for marketing, influencing your doctor, and more. Not to mention that in the last 2 years, 77 data breaches have been recorded across the My Health Record system, as we reported earlier this year. Where will your data end up, and who has access to this ultimately? These are questions we must ask ourselves. To make things worse, for anybody looking to disconnect from the established medical order, alternative remedies are increasingly becoming harder to find, the result of a systematic attack against both providers and the consumers of medicines such as herbalism and homeopathy. In January, the Australian government passed health insurance reform laws that end public and private health cover for a range of natural therapies such as herbalism, yoga, homeopathic methods, and more. From April 1st, 2019, the government will no longer subsidise for a range of natural treatments, and health insurers will no longer be able to provide cover for, quote, non-permitted therapies. The new crackdown is part of moves that began in 2015 when a government report concluded that 17 natural therapies offered through health insurance, quote, hadn't been proven to work on patients. As a result, treatments and therapies such as aromatherapy, Bowen therapy, homeopathic methods, and more will not be covered under publicly and privately funded health insurance schemes. Many have expressed outrage at the decision, citing that rising costs will now spiral out of control, alternative medicines will become scarce, and accessibilities of businesses and providers no longer listed on insurance lists or premiums will be hurt. Furthermore, many natural health advocates have attacked the pharmaceutical industry for continuing to create a monopoly in the Australian medicine market, one that, despite them accounting for less than 1% of benefits paid, is increasingly moving to eliminate any alternative options. And can you blame them? For example, the percent markup of the prescription drug Xanax is approximately 570,000%. That means that the consumer costs per 100 tablets is roughly $137.79, while the cost of the active ingredient is $0.024. Why wouldn't Big Pharma do everything in their power to try and expand this wherever possible? Not to mention the cost of prescription drugs rises 12% each year. Pretty good incentive, if you ask me, to drive alternative competitors out of the market, thus allowing the monopoly to continue unchallenged and under a mask of secrecy indefinitely. This is just one small example of the power and influence of Big Pharma in Australia, folks. Indeed, the pharmaceutical industry has established itself as a Goliath that reveals no signs of slowing down or being regulated anytime soon, ultimately choosing profitability and sustainability over the mental and physical health of thousands of Australians. It doesn't just end at prescriptions either. From vaccinations to water fluoridation to diets and organ donation, even beauty, Big Brother's tentacles remain embedded in the fabric of all aspects of health in Australia, and unless addressed, called out and stopped, will continue to pull the strings of the mainstream establishment to serve their agenda. Thank you for watching, and if you liked this video, remember to tell me your thoughts in the comments section below. Also remember to share this information with family and friends who may be interested, and as always, check out tottnews.com for more information and coverage. That's all for today, folks, and until next time, remember to be kind to one another.